I was actually really taken aback when I learned about the prevalence of torture in refugee communities. And so I think for me, it really was sort of like one of those, oh my gosh, moments where I realized that I was not recognizing torture survivors in my own patient population, and certainly just started to understand the impact that torture has, not only on the mental health of an individual, but also the physical health.
When I was arrested, I was taken to a place called the Central Prison. For there, I was in prison for like 2 weeks. I've been tortured, both day and night, live in a very small shell which is infected with mosquitoes, and you don't have like enough food. It was very brutal, very hard, you know.
It's not uncommon for people not to want to be filmed or to talk about their situations and have their faces viewed by others. It's also, torture is really shameful for many people, and it's this enormous weight that they carry without UHHR by their side, without the therapist, the case management, all of the holistic services that are offered here. My patients wouldn't do well.
So I'm a consulting psychologist here for UHHR, and I work with children who are primarily secondary survivors of torture and severe war trauma, and their mothers. You know, one of the most painful things when families relocate here is the fear they feel, and they're all experiencing the transition in different ways. And to watch children recapture the capacity for joy and love is just tremendous. To see their families getting stronger, it's just incredibly moving.
So we are absolutely thrilled to have received very generous support from Intermountain Healthcare this year, and it's really helped fund all of our programs. There are 36 torture treatment centers nationally, and so we are one of those centers. I feel really privileged to get to work with individuals who don't take for granted anything that they've been given, that have enormous resilience.
Yeah, I feel very confident on my own now. I don't have like fear that I used to have before. I feel very, very comfortable. And there are many people out there who need their help, and they render it to their level best, you know.
Despite the horrors that someone has experienced, they still have a will to live and to live a very full life and want to get back there. And so to be able to help someone or see them through that process is a total privilege.